Thanks for joining me. So, what happens in a clinical nutrition consultation? Well, it's in the privacy of these four walls in my home and in the privacy of your four walls. And that's important because it needs to be a confidential conversation on both sides of the conversation. And it is a secure link for the meeting. And I've chosen Clinico as my medical health records partner. And the reason I've chosen Clinico is it's an Australian organisation that guarantees that the online information is stored in the Australian region. Other providers cannot guarantee that, and so I didn't go with them because it's important that your data is covered by Australian regulation. And I go further and I treat your data with the utmost security by not only having a password but having two-factor authentication. And I think that's important to point out that if I was traveling somewhere and my laptop got stolen, none of your medical health records would be available to be accessed. So I wanted to make that absolutely clear. And in the consultation, when you join with an initial consultation, I'll send you a consent form, and it does have a lot of pre-screening questions in there because I want to be able to spend the 1 hour initial consultation with you and asking you lots of questions. And it's for someone who's never seen a holistic practitioner before, it can seem, wow, this is a lot of questions. Because we're getting a whole view, point of view, and whole view of not only your nutrition, but your diet, your lifestyle, um, your stress levels, your sleep, your previous medical history, whether you've been hospitalized, if you're taking any supplements now, if you've been prescribed any medications. And that's a very important one because before considering what other supplementation that could possibly help you right now, is that I need to look at that and do a safety check based on the medications that you're prescribed to see are there interactions that will be harmful for you if you take a supplement. So that's so very important that we go through those details. And we assess, or I assess, I should say, common metabolic conditions, any digestive complaints. Just looking at my notes here that I take notes on an initial consultation. Immune system conditions, any mental health conditions, any other diagnosed conditions or specialist care. And then we go through an investigation and, what is your complaint? Where's the location? How long have you been suffering with that? I don't want to go through all of it because we'll be here for an hour. And how that's affecting you and things that are better for worse, right? And importantly, if anything's said there that is a flag, whether it's a red flag, meaning you need to see go to a hospital or go and see your GP today, because that could be very serious to you if you do not, or perhaps you need to see a medical professional that week. That's something that I'm bound as part of my code of conduct and professional standards to do that, and I will do that. And I mentioned the medications. Then we go through some anthropometrics such as weight, height, waist measurement, and do some calculations there if you're comfortable in doing so. And if you're not comfortable in doing so, we don't have to answer some of the questions. It's totally up to yourself. It is private and confidential. But the more information we can ascertain in these sessions is the more I can get a complete picture of what's happening for you right now and make a more educated decision of what needs to happen and what goals we need to have for you to achieve your medical aim and your health goals. And just looking through here, and particularly with weight, because weight loss is my special interest area. And when in your life if you've been a certain weight, how long has it been since you've been that weight? What's your adult weight? What was your adolescent weight? Your early childhood? past dieting history, and major life events. I can go through, and for systems, we go through probably about 3 body systems, but which could include your nervous system, your digestive system, very important, your bowel frequency, your circulation, your immune system, skin, hair, and nails, if appropriate, endocrine or metabolic system, your reproductive system, and then being a nutritional consultation, we do a dietary assessment. We look at eating habits, meal timing, just looking at some of these fluids, and we'll go through a dietary recall, and that can be last 24 hours, or it could be further than that, depending on what the information is presented. And then we go through a plan, and it's not just nutrition, right? It's a plan for nutrition, and that can be in terms of what guidance to look for. And that's why I do the videos of Real Life Nutrition with John, because what happens in a consultation is very different when you're at the shelf and don't know what's a good decision. And that's why I do quite a lot of videos in that regard. Lifestyle interventions, supplement protocols, any functional testing that may be appropriate, that may help you. I'll go through that in the consultation, and as a practitioner, I'm able to order them for you. Or if it's something that you can request from your GP, I'll discuss it there. And importantly, any medical referrals where I need to write to your GP and request further investigations for any signs and symptoms that are appropriate for you right now. And I'll close with a follow-up time frame when is appropriate to come back and assess your progress with these goals or any hindrance with these goals. And there is some section there of any blood pressure and pulse and respiratory rate that we can assess on the day. Anthropometrics, I went through that. If you have any recent bloods, that can also help. Not essential, but it can help. And then I go through a working diagnosis, look at the key drivers of that, and go through some short-term and some long-term treatment aims. And so that, without going through everything, is basically what happens in a clinical nutrition consultation, in an initial clinical consultation, that happens in a secure environment. And if you do have any more further questions on that, please don't leave a comment below. I'd like you to come straight through to me, either in email or go through and in the booking link, book a consultation and select Discovery Call. And that's a no-fee, 15-minute private conversation in these 4 walls, or in my 4 walls, in your 4 walls. And you can ask me any questions that you've got and talk to me a bit about what you're presenting with now and how I might assist. Okay, I hope that cleared that up for you, and look forward to speaking with you soon.